COVID-19 is a severe acute respiratory disease. It follows then that those with already compromised respiratory systems are at much higher risk of unfavorable outcome if infected. Clearly, smokers fall into this category. And so today, we shall focus on tobacco and its ill effects on health. The world is facing a huge public health epidemic in the form of tobacco use. It is estimated that worldwide, about 1.3 billion people are tobacco users. Low and middle-income countries, where 80% of tobacco users live, bear the heaviest toll of the tobacco-related illness and death. Half of chronic users of tobacco end up dying from its use. Each year, tobacco use causes more than 8 million deaths globally. 7 million of these are as a result of direct tobacco use, and over 1 million are as a result of non-smokers being exposed to second-hand tobacco smoke. Nearly half of all children breathe air polluted by tobacco smoke. 65,000 children die each year due to illness related to second-hand smoke. Smoking during pregnancy is dangerous as it can lead to several lifelong health conditions for the yet-to-born baby. Tobacco use also has significant socio-economic impacts by driving increase in healthcare costs, poverty, and loss of productive human capital. Tobacco use and exposure is a major risk for non-communicable diseases, which include heart disease, stroke, cancer, diabetes, and chronic lung disease. These conditions are collectively responsible for almost 70% of all deaths worldwide. Tobacco smoking is a known risk factor for many respiratory infections and increases the severity of respiratory diseases. Smoking any kind of tobacco reduces lung capacity and increases the risk of many respiratory infections and can increase the severity of respiratory diseases. The act of smoking and the social nature of many forms of tobacco use present risks of person-to-person transmission of respiratory diseases such as the SARS-CoV-2 virus that causes COVID-19. The most common form of tobacco use is cigarette smoking. Other tobacco products include water pipe tobacco or shisha, various smokeless tobacco products, cigars, pipe tobacco, biddies, and others. All forms of tobacco are harmful, and there is no safe level of exposure to tobacco. Often, users of these other forms of tobacco do not understand or appreciate their health dangers. Smokeless tobacco, that is tobacco used by sniffing, chewing, or placing between the gum and cheek or lip, equally increases the risk of severe disease when one is infected by COVID-19. Its use presents a risk in spread of infection through product handling, frequent spitting, and sharing of paraphernalia such as mouthpieces and hoses. Smokers often have a persistent cough, and infected COVID-19 smokers who are not yet symptomatic could be a source of spread of infection, as the cough can easily be dismissed as a smoker's cough. Nicotine, the active principle in tobacco products, is highly addictive. Several devices and products have been developed as nicotine replacement therapy to break nicotine addiction. These include nicotine gum, nicotine patches, sublingual lozenges, electronic nicotine and non-nicotine delivery systems, commonly referred to as e-cigarettes, and others. Most of these products use pure nicotine and could be harmful and increase the risk of heart disease and lung disorders. These alternate forms of tobacco use and nicotine replacement therapy, largely targeting the youth, have been deceptively promoted as reduced harm products and or products to help people quit conventional tobacco smoking. These products expose users to toxic, cancer-causing emissions, and currently there is insufficient and persuasive evidence to suggest that they are less harmful than conventional cigarettes. Kenya signed, ratified, and domesticated the World Health Organization Framework Convention on Tobacco Control and further enacted the Tobacco Control Act of 2007. The spirit of embracing the convention and enacting the law is to discourage the use of tobacco and reduce or altogether eliminate its use and its harmful effects on health. For there are no safe tobacco products. Remember, tobacco is harmful in all forms. We urge those who use tobacco in any form, whether cigarettes, water pipes, biddies, cigars, or heated tobacco products, to place their health first and quit the habit. The ministry operates a quit tobacco use service accessible by calling the toll-free Quit Tobacco 1192 line.